Hello and welcome back. My name's Kris, I'm an Australian GP, and this is part 2 of my pregnancy series. In part 1, we talked about you're pregnant, now what? And talked about what to expect in the first and part of the second trimesters. And in today's video, I'm going to be taking you through the 7 things that I hope all my pregnant people know after their first or sometimes second visit. The next part of this series, part 3, will be about the most common discomforts in pregnancy and how to mitigate them. So please like and subscribe, hit the notification bell so you are aware on when that video goes live. But without further ado, let's jump into the common discomforts in pregnancy and how you can manage them. But without any further ado, let's jump into the 7 things that I hope that all my pregnant people know as they leave my room when they find out that they're pregnant. Number 1, there is no safe level of alcohol, tobacco, marijuana, or other illicit drugs in pregnancy that won't impact the pregnancy or the fetus itself. I do really suggest that you chat with your general practitioner, midwife, obstetrician, whoever's in your healthcare team if you feel that giving up any of the above substances will be difficult for you. Pregnant people are also encouraged to avoid things like Nurofen and aspirin in most cases, as this can be very detrimental to bub's developing body. Most medications are okay to take in pregnancy, but if you take something regularly, like an antidepressant or a blood pressure tablet, or anything really, please chat to your GP as to whether or not it is right for you. Medications are graded in pregnancy from safe to really not safe, and it really depends on your specific situation as to whether or not you should continue particular medications. Number 2, we recommend that you commence a folate and iodine supplement before you fall pregnant. Ideally, you should start a folate and iodine supplementation at least 3 months before trying to conceive. And this is because folate is super important in the development of baby's brain and spinal cord. And iodine is super important in the development of baby's hormones, particularly thyroid hormones, for example. That being said, for my people out there who find out they're pregnant and had no idea about the folate beforehand or were not expecting the pregnancy, as soon as you find out, start a supplementation because you'll be doing the best thing you can for you and your developing bub. We recommend that you take the supplementation for the first trimester, so that means finishing it after 12 weeks. Number 3, if you're like me and you have cats, my pregnant people out there, you're not allowed to change the litter. This is because cat, especially cat feces, can carry a specific bacteria known as toxoplasmosis. Toxoplasmosis infection can be very detrimental to bub. So if you have someone that can change the cat litter for you, excellent. But if you're the only one who can, just be very well aware to wear gloves, double bag, and just don't touch if you can help it. Number 4, there are some very strong recommendations out there about food intake in pregnancy and a lot of things that you should not have and a couple of things that you shouldn't have unless it fits certain criteria. It's a really confusing time and it can feel like you've got nothing to eat. So I will put a link below to a fantastic table that I use in all of my pregnancy consultations to help kind of alleviate that fear that you won't be able to eat anything. In particular, it's really recommended pregnant people don't ingest unpasteurized milk, soft cheeses, deli meats, salads that have been made by someone like at Subway, for example. Not anything nasty about Subway, just pre-prepared salads, for example. Raw seafood, that sort of thing. And this is because when it's uncooked or it's unpasteurized or it's been touched by someone else, you risk infection, particularly listeriosis. And this, just like everything else I've mentioned before, can be really detrimental to the developing fetus in the pregnancy. 5, exercise wisely. So if you were doing exercise before pregnancy, as long as it's not high contact and you're not overheating, you can continue it throughout pregnancy until your body says you can't. Work out within your limits and remember to try and make sure you don't overheat. Number 6, caffeine. To all of my pregnant people out there, you can enjoy up to 200 milligrams of caffeine, which is the equivalent of maybe 1 to 2 coffees, 2 or 3 teas, a couple of cans of soft drink. There is a lot of evidence to say that the less caffeine, the better in pregnancy. But as a caffeine addict myself, I understand how difficult it is to cut down. So 200 milligrams is the safe limit. Check out the coffee that you drink, as different beans, different rows, different preparations can really change the caffeine you're ingesting. And finally, number 7, changes to your mental health are exceptionally common in pregnancy. not only is your body changing, but your family unit is changing, and you have all of these hormones circulating that you didn't before, or at least not at these levels. So it's not uncommon for pregnant people to have a wide range of emotions. That being said, I really want to highlight that perinatal anxiety and depression, which is different to postnatal anxiety and depression, is super prominent and something that is not talked about enough. Like I said, there is some expectation that people can be more anxious and more tired and teary during a pregnancy, but if you or those around you are concerned at any point about your emotions and the way that your mental health is during a pregnancy, please reach out for help. Not only is your general practitioner, midwife, and obstetrician really well equipped at helping you, but there are online resources as well, such as Panda, which is a website and a phone number you can call, which talks all about perinatal anxiety and depression. I also strongly highlight to all of my families that perinatal anxiety and depression can affect dads too. Whilst they don't have the physical changes of pregnancy, they have the societal changes, the familial changes, they're watching their partners go through the pregnancy. So it's a really intense time for dads too, or partners of a pregnant person. In fact, 1 in 10 dads or partners of pregnant people can have perinatal anxiety and depression. I don't know why I paused so much, that was really hard to get out for some reason. So if you're concerned about your partner, or you are the partner and your mental health isn't doing so well, reach out for help. It's completely valid and help is available. And that's it, guys. That was 7 things that I hope all of my pregnant patients know when they walk out of their first or second consultation with me after finding out they're pregnant. Of course, this is general advice and I can't give specific healthcare advice to any one particular person via the internet at least. So if you have any questions about pregnancy in general or general tips and tricks, please do let me know. I will be now filming part 3 to this, so you'll see that next week. So if you would like, please like, subscribe, hit the bell so you know when I post the next video. All that YouTubey stuff, guys. I really want to hear from you. But until the next video, stay safe, stay healthy, and I'll see you very soon. Bye.